This medication is prescribed for the treatment of specific types of cancer, such as marginal zone lymphoma and follicular lymphoma. Umbralisib, the active ingredient in Ukoniq, is classified as a kinase inhibitor, which works by slowing down or halting the growth of cancer cells. It is important to note that this drug has been withdrawn from the U.S. market due to safety concerns. If you have been prescribed this medication, it is essential to follow your healthcare provider's instructions regarding its use and any potential alternatives. Before you start taking Ukoniq 200 mg tablet, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with food as directed by your doctor, usually once daily. Do not crush, break, or chew the tablets. The dosage is based on your medical condition, lab tests, and response to treatment. If you vomit after taking a dose, do not take another dose at that time. Take your next dose at the regular time. Use this medication regularly to get the most benefit from it. To help you remember, take it at the same time each day. Do not increase your dose or use this drug more often or for longer than prescribed. Your doctor may direct you to temporarily stop or reduce your dose if you have side effects. Your doctor may also prescribe other medications to help prevent infections. Since this drug can harm an unborn baby, women who are pregnant or may become pregnant should not handle this medication or breathe the dust from the tablets. Some common side effects of Ukoniq 200 mg tablet include diarrhea, nausea, vomiting, decreased appetite, muscle/joint pain, trouble sleeping, or tiredness. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. While using this medication, there is a possibility of experiencing serious side effects. However, your doctor has prescribed this drug because they believe that the benefits outweigh the risks. Your doctor will monitor you carefully to minimize any potential risks. Contact your doctor immediately if you experience any serious side effects, such as severe diarrhea, stool with blood or mucus, easy bruising or bleeding, swelling of the ankles/feet/hands, or signs of liver damage. It's important to be aware that Ukoniq may lower your ability to fight infections, increasing your risk of getting a serious infection or making an existing infection worse. Seek medical help right away if you notice any signs of infection, such as a persistent sore throat, fever, swollen lymph nodes, shortness of breath, or cough. While Ukoniq can cause a common rash, there is also a rare rash that could indicate a severe reaction. If you develop any rash, seek medical help immediately. Although a serious allergic reaction to this drug is rare, it's important to seek immediate medical help if you experience symptoms such as a rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects, it's essential to contact your doctor or pharmacist. Before starting Umbralisib, make sure to inform your doctor or pharmacist about any allergies you may have, and ask about any inactive ingredients in the product that could cause allergic reactions. If you have a recent or current infection, let your doctor or pharmacist know before using Umbralisib, as it may increase your risk of getting infections or make current ones worse. Avoid contact with anyone who has a contagious infection, and speak to your doctor about any immunizations or vaccinations before starting Umbralisib. Also, be sure to inform your healthcare professional about all the products you use before having surgery. If you are pregnant or planning to become pregnant, it's important to talk to your doctor about reliable forms of birth control, as Umbralisib may harm an unborn baby. Men and women using this medication should ask about reliable forms of birth control during treatment and for 1 month after the last dose. It is also advised for pregnant women or those who may become pregnant to avoid handling the medication or breathing in any dust from the tablets. Breastfeeding is not recommended while using Umbralisib and for 1 month after the last dose, as it is unclear if the drug passes into breast milk. Make sure to consult your doctor before breastfeeding while using this medication. When taking Ukoniq 200 mg tablet, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without first obtaining approval from your doctor. This will help ensure the safety and effectiveness of your treatment with Ukoniq. If someone has taken too much Ukoniq 200 mg tablet and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the US, residents can contact their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It is important not to share Ukoniq with others, as it is prescribed specifically for your condition. Before starting this medication, you will need to undergo certain lab and medical tests, including a complete blood count, kidney and liver function tests, and blood potassium level tests. It is crucial to keep all medical and lab appointments and consult your doctor for more details on these tests. If you forget to take a dose of Ukoniq and it's still more than 12 hours before your next dose, go ahead and take it as soon as you remember. But if it's less than 12 hours until your next dose, then just skip the missed dose and take your next one at the usual time. And remember, don't take extra doses to make up for the missed one. It's important to store Ukoniq 200 mg tablet Antineoplastic, Phosphatidylinositol 3 kinase delta Inhib. At room temperature, away from light and moisture. Make sure not to store it in the bathroom, and always keep medications out of reach of children and pets. When it comes to getting rid of this medication, don't flush it down the toilet or pour it into a drain unless specifically told to do so. Instead, dispose of it properly when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.